All right. Hello. Looks like we are live now. Happy Wednesday, everyone. I am super excited to be back with another Ask the Expert session. And our topic today, I'm super excited about because I have so many questions, and I know lots of other people have lots of questions because this has become a very big thing across the United States. So before we dive into our conversation, let me introduce our guest. I have Dr. Marion Martin joining me today, also known as the Hormone Hacker. And Dr. Marion, thank you for being here. I would love, before we dive into this conversation about Ozempic and all the things you need to know, can you share with us a little more about your background and what it is you do as the Hormone Hacker?
Absolutely. So I have been an endocrinologist now for 19 years. In the beginning of my career, I practiced traditional sick care. And in the last couple of years, I have been able to shift how I think about treating and preventing disease. And that's what I do now as Dr. Hormone Hacker is I help people rebalance their hormones, but in a holistic way.
And so before we dive into the conversation, I always like to share my personal views on these topics as well. And Marion had shared something in our community, and I thought, ooh, that's what I need in my life right now. And I personally have been working with Dr. Marianne and have gotten great support and resources to help restore my health, right? It's really focused on the habits of what I'm eating and what I'm drinking and how I'm moving my body. But I have to say, after a month, I feel so much better. Um, and that I think is a testament to the work you are doing, which I love. But there's a hot topic these days, which is Ozempic and these other weight loss medications. And so I'd love to have a conversation about this because obviously you're an expert on how all of this really works. And so to dig into your insight and understand truly what does it do? How does it work? What are the benefits? What are the side effects? So let's just start with Ozempic. How does it work? Who is it for? What does it do? If you can kind of give us that background information to start.
We're going to go way back to 2005, Megan, because that is when the very first GLP-1 drug was launched in the United States. And I remember I was in my first year of fellowship training in endocrinology, and we were all abuzz about this new drug, which was called Byetta at the time. Now, just to show you how far we've progressed in pharmaceuticals, back then, the drug was an injection that you gave twice a day. Right now, it's once a week, but it started off as an injection twice a day. The needle was 10 times bigger than what Ozempic is right now. I mean, it was almost barbaric. And so we've come a long way. But the reason why there was such excitement about this class of drugs is because we've never had anything work like this before. Now, our bodies make GLP-1, which is a hormone that is made in the stomach. And once you start eating, typically around 10 to 15 minutes after your brain realizes that you're eating, this stomach hormone, GLP-1, is supposed to travel to your brain to tell you that you are starting to get full. Now, I can tell you, Megan, I've treated a lot of patients who told me, I don't think I make this. I don't think I've ever had this signal to tell me that I'm full. And it's true. There are some people who actually have a deficiency. It's rare, but there are some people who really never get the signal. So they're constantly overeating.
Mm.
And so the hope with this medication was that it was going to allow you to feel full sooner with less portions, but without feeling like you're starving yourself, like on a diet. So it was this magical promise that you're going to eat less, feel satisfied, and you feel full longer because it keeps the food in your stomach for a longer period of time. So that was everything that was promised. Now, we do see that there are some cardiovascular benefits as well. So, for example, in a trial, Ozempic was shown to reduce heart attacks and strokes by 20%. But let me put a star by that. The average person in this study lost 9.5% of their body weight. I'm going to share that if you lose 5 to 10% of your body weight on your own without the use of any drug, you're going to get the same 20% reduction in cardiovascular event. So this isn't anything that's just, significant for Ozempic. Anytime you lose a significant amount of weight, you're going to benefit your entire metabolic health.
Mm-hmm. Mm-hmm. Yeah, I appreciate that backstory because I didn't know all that information. And I see lots of people in the chat that appreciate this as well. Big shout out to everyone saying hello in the chat. Thank you for being here. As we're live, if you do have any questions that come up, pop them in the comments on LinkedIn and I'll pull them into the conversation. So very interesting background. And I think I mean, I've seen this work for many people, but can you talk about some of the side effects of Ozempic?
The most common, which I think people are very familiar with, is 50 to 80% of people have nausea. That's a tremendous amount of people. And up to 30% actually have vomiting. And I remember the way that I used to counsel patients before they started on this drug was I would have to say, I need you to eat extremely slowly, 1 or 2 bites, and then stop and pause and think about how you feel. And only if you're still hungry, take another 1 or 2 bites. But the trick is you need to stop 2 bites before you're full. You need to stop when you're satisfied. And I would tell them if you eat 1 or 2 bites more than you should, you're only going to increase the risk of nausea and vomiting. So that actually scared them. So they definitely slowed down. But the other things that we can see is a change in bowels, either constipation or diarrhea. And a lot of people can get headaches as well. Those are the most common ones. Let me highlight some of the rare and more serious side effects. And I will say these are occurring in less than 10% of people, but it's important to know. Pancreatitis, intestinal obstruction, gastroparesis, which simply means that there's a severe delay in how food moves through the stomach. And then let's talk about the most interesting one, which is medullary thyroid cancer. And I want to clarify this point because number one, it was only shown in rat studies. So it's never been shown in humans. However, here's the flip side. There is actually a black box warning on Ozempic about thyroid tumors. A black box warning is the most serious safety alert that the FDA ever issues. So even though it's never been found in humans, you have to wonder, why did they put a black box warning on this?
Mm-hmm. Mm-hmm. Interesting. This is all very interesting to me in a world that I don't spend a lot of time in. So I appreciate you being here, sharing these insights and information. So obviously a lot of people have gone this route for weight loss. How is this type of drug best used for weight loss?
Well, first of all, the most concerning thing is if you look at the prescribing information on the actual box of Ozempic, it actually states that it is a lifetime drug,
Mm.
not a kickstart, not a let me just, see how I feel for a couple. No, they actually want you to be on this for life. And the reason possibly is that they know as soon as someone stops the medication, the weight regain is fast and furious. And the problem is that while you're losing weight on the medication, you are losing fat, but if you're not educated and doing the right thing, you're losing a tremendous amount of muscle as well. When you regain the weight, you're only regaining fat. You're not regaining muscle. And especially for postmenopausal women, it is hard to build muscle. And so this is a serious problem. And they even did a study where they already had these patients who were on semaglutide for 18 months. They lost all the weight that they wanted to. And then they did an extension study and they said, hmm, let's see what happens 1 year after they stop semaglutide. Now, the other interesting thing is while they were in the study, not only did they have the semaglutide once a week, but they also had access to lifestyle counseling. When they were in the extension part of the study for a year, there was no more lifestyle counseling. But to tell you the truth, Megan, that's the real world. When people stop this medication, it's not like they're hiring a coach to help them with that transition. They just feel like, okay, I've already lost the weight. I guess I can stop the medication now. So, what ended up happening in this extension study, 1 year after stopping semaglutide and lifestyle counseling, they regained 2/3 of the weight back.
Wow.
Yeah. And so we, as providers prescribing these medications, we first of all have to do better in helping people with the transition. But I'm going to say it actually starts before you even put the person on the medication. If I'm having a conversation with someone who's thinking about being on this medication, I'm going to ask them some tough questions. Are you ready to overhaul your entire lifestyle before you begin this? Which means your diet is not going to be the same anymore. It can never be the same anymore. Otherwise, you're going right back to where you started.
Mhm.
Are you going to commit to exercising minimum 5 times a week? And a couple of those times is going to be strength training and weights so that you're building muscle. Are you going to prioritize your sleep? And are you going to do the best that you can in reducing stress in your life? Because guess what? Sleep and stress affect your GLP-1 production. And if you're no longer on this medication, you are going to have to do everything that you can to maximize producing this on your own.
Yep.
So that conversation has to be done before you start the medication. I would also recommend people who have access to like a body composition scale, which they have at a lot of gyms. They even have that at many doctors' offices now. You should get a baseline of what your body fat and your muscle mass is and be able to track it while you're on this medication.
Mhm.
That's a big eye opener right there.
Yeah.
And so, yeah, there are a lot of things that somebody needs to commit to, and the provider needs to have that conversation.
Right. Absolutely. Absolutely. Karen had commented a few minutes ago, it's not a magic potion, right? It still requires a lot of discipline. And
Absolutely.
And that's we use this saying a lot for a lot of things, right? There often is not a magic potion to just make everything we don't want go away. And this is the same. There are a couple questions here in the chat that I want to circle back to. So somebody's asking about Ozempic in relation to diabetes. Their father was prescribed it before costs went sky high and thought it was more for his diabetes. Can you
Mhm.
comment on that?
Yeah, so actually, again, when it was first launched in 2005, it was only FDA approved for diabetics. And I can tell you, for the right diabetic patient, it is a game changer. It really is, because what it does is it tells the pancreas to make insulin when the sugars are starting to go high, but it doesn't allow this to happen when the sugars aren't high. So, unlike other diabetes medications, it's not known to cause low blood sugars in and of itself. So, that's a game changer right there because so many other diabetes medications cause hypoglycemia. And the other thing is, it tells the liver, hey, we have enough sugar in the bloodstream. Stop dumping so much extra sugar out here. So it does absolutely help people with diabetes. So again, they are the perfect population to have this medication. I'm not saying that it's not for people who are overweight or obese. We now have three GLP-1 drugs specifically FDA approved for overweight and obese. But I think they're severely abused. I think there are too many people who are prescribing it who don't know how to educate the person ahead of time. But I think for most people who have diabetes, this is a conversation they need to have with their provider on the best way to start it and how to exit it. Because it's not supposed to be a lifelong medication. It really isn't. And the other thing I'm going to share, even for diabetics, I'm of the proponent where I've always been the lowest dose that's effective for the shortest amount of time. It drives me crazy that there are protocols that people follow, and it doesn't matter how well the medication is working. Oh, it's week 2, we got to crank up your dose. No, if it's working at whatever dose, you don't have to increase the dose. I don't want people to have to max out the dose earlier than they need to.
Absolutely. So in talking, you mentioned a few concerns that range kind of on the ethical side of this, right? And I think dosage is a big thing, having the exit strategy. Are there other ethical concerns that you have in terms of how these medications are being used?
Megan, we don't have time for all the ethical concerns, but I'm going to focus on 4. So, since we just addressed the diabetic patient, back in 2022, there was a shortage of Ozempic. And guess what? There were so many people who wanted to follow what the celebrities were doing in taking Ozempic for weight loss that there was very little left over for the people who actually needed it. So there were huge amounts of diabetics who couldn't get their Ozempic. That is dangerous. The second thing is, here's the ethical concern that I really think is an eye opener. So Novo Nordisk has their base in Denmark. They charge their citizens $100 or less for Ozempic. And yet in America, we can pay up to $1,800.
Wow.
The other thing is, our system of healthcare absolutely needs to change because, again, in Denmark, doctors can actually prescribe diet and exercise and be reimbursed. And the patient can actually go to a gym or get good quality foods and be subsidized by the government. We don't have that system here. And so that's a huge ethical concern, is that the high cost and the availability and unequal access, because people are going to get priced out. So that's another ethical concern. Oh boy, this next one really like hits me hard, especially if you're a mom, because the American Academy of Pediatrics came out with a recommendation that any child starting at the age of 12 years old, if they are overweight or obese, should be on a medicine like Ozempic at 12. And again, this is supposed to be a lifelong drug. You're going to have someone at 12 take Ozempic once a week as a shot for the rest of their life? Exactly. So that I have a big, big concern about. And then the last issue, which people don't realize, is that when you get a compounded version of these drugs, semaglutide, etc., these are not FDA approved. There is no agency that is checking on the purity of what you are taking. I just spoke to a client yesterday, and she said, you know what was so weird was that the first time I got semaglutide, I was so sick. I couldn't tolerate any dose, even the lowest dose, like half the dose of the lowest dose, I couldn't even tolerate. And then I gave my body a chance to rest. And 3 months later, my doctor wanted to try it again. And this second batch from a different compounding pharmacy, no nausea, works like charm. But the problem is that every compounding pharmacy has a bevy of distributors to choose from. in terms of who they get their compounding drugs from. So what you're taking today may not be what you're taking next month. And so that's a big ethical concern.
Mm-hmm. Mm-hmm. I'm reading the LinkedIn Live comments. There's a lot of feelings about this. And somebody says she has 7 children, which is a lot of kids. That's amazing. And there's always a phase right before puberty where they get a little fluffy right before the growth spurt. I can't imagine promoting this in children. Absolutely agree. I have 3 kids and I just, it seems crazy to me that that's the recommendation. Um, and so I want to, as we start to wrap up, because we will run out of time, but I can assure you, Marion and I are having more conversations in the coming months, and we'll circle back to this. We also have her LinkedIn profile linked right in the episode information. So definitely go follow her and reach out if you're looking for support. So obviously there's options when it comes to wanting to lose weight. And I'm gonna bring this back up only because I have talked to you specifically about this, right? I've reached an age where suddenly my habits don't work the same as they used to. Um, and so can you just shed a little light on for the person that's sitting here going, okay, well, maybe this is right for me, maybe it's not. What are some of the things they should be doing and any advice or tips that you offer?
Well, so for anyone who is already on a GLP-1 drug, let's just make sure that you have a conversation with your provider. How much protein am I supposed to have each day? And if your provider doesn't have that answer for you, you need to seek a different source. Because again, everything that I currently know about holistic healthcare I actually had to teach myself. This was nothing that I learned in medical school. So don't be surprised if you get a wide-eyed look back from your healthcare provider and they have no idea. It's not their fault. But as your own best advocate, you should know that protein is the most important thing for you to have in your diet on a GLP-1. And the second most important thing is having at least 3 days a week of some weight training. I don't need anyone to injure themselves by lifting heavy weights, but again, starting with 5 pound weights or anything is great. And then you build up from there.
Well, thank you so much for all of this information. Thank you to everyone that was watching live as well. All your comments always make these more interesting and help us really relate to your questions and how we can best support you. Dr. Marianne, always appreciate your support, your advice, all these health things. I love the work that you're doing, and I think it's super important. So thank you for showing up here with us today. To everyone else that was live, thank you. As always, we will be back again next week with another Ask the Expert. And in the meantime, if you need any support, please don't hesitate to reach out to us here at IAW. Thanks, everyone.